Lou is Lynn's husband. Lou is quite a partner. He maybe 98% of the time, if Lynn's there, Lou's there. He's also a very unofficial photographer for God knows how many events we've done over the years, okay? I actually rely on him for some pictures from time to time. But since it is not uncommon for transtracheal patients' spouse or partners to say that they've noticed quite a difference in their partner, I thought I'd ask Lou a few of those same questions and see the differences he may have seen over the years with his wife. So let's start with, it goes back about 9 years now, according to what Lynn just told us. And you were there from the beginning to the end. How did it seem to go sort of around the time of the procedure? Was it crazy? Was it organized? Did it go pretty well?
Well, I think it went very well. I don't recall any serious issues with the procedure. I thought it was straightforward.
And when Lynn came home the next day or so, did it seem like it was taking an inordinate amount of time for her to learn how to clean the catheter?
No, I don't think so. I think it went right along pretty smoothly.
Okay. And did you notice, or do you notice, or maybe not because she's so active all the time anyway, any change in her, her energy level, any change in her confident level, any change in her ability to do maybe somewhat more or maybe a lot more than she was able to do before, or is Lynn just Lynn?
Well, I think it was a gradual increase in ability.
Mm-hmm.
But the main thing I can recall is that there just weren't problems. Everything was very positive.
Okay.
And went along smoothly. There was a decrease in the oxygen flow that she had to have. So of course that extended the time that the liquid would last, and for portable units, and for that matter for the reservoirs.
And how about, Lynn said a little bit earlier that she went and looked in the mirror and she almost felt she got her face back. Did you get her face back?
Yes, absolutely.
Was it nice?
Oh yeah.
Was it nice to kiss again without a cannula?
Well, I guess my problem is that I never had a big bad thing about the cannula.
Okay.
So it was a nice change, and it certainly brightened her perspective on her overall view of things.
And what about, we throw this term quality of life, and I don't know that we know what that really means, but generally we kind of know. What would you say happened to her quality of life from before to after?
Oh, it increased tremendously. There's just so many subtle factors associated with it. I can think of no negatives and all positives is kind of where I'm sitting.
You come to almost all the same meetings with Lynn and me, and you see almost the same people around the room, same ones with the cannula, even though Lynn is there as a living example of how well the catheter works. Yet, as the people around the table, apparently are never going to even look into it. Any explanation for why? Are they just afraid of the opening? Are they afraid of the commitment? It certainly can't be the money because it's been covered since the first day. So I'm trying hard to find out why some patients are motivated, like your wife, to go find out more and then go ahead and do it. In other words, why wait till I'm sick enough to have it compared to, let me get this done earlier, get quite a few more years of quality of life, as she said.
Well, I don't have good evidence for this, but I think maybe it's the lack of enthusiasm on the part of the healthcare providers. It seems to me like that the doctors, the pulmonologists, have not endorsed the procedure as enthusiastically as they might. And then there's these little subtle things like the arguments, like infections, and I'm just wondering if the doctors consider it a kind of a pain in the neck, rather than
good line, pain in the neck.
I avoided the other expression.
Yeah.
So I don't know. I don't know. I have not seen enthusiasm on the part of, real enthusiasm on the part of the medical people.
Now, I know you both take care of each other very well. Has her transtracheal catheter added to your caregiver burden?
Not significantly, no.
Okay.
I mean, sure, there's equipment, and there's a little bit more work, but I don't consider it a burden
Okay.
in any way.
Because the benefit.
The benefits certainly outweigh the any I don't even want to call them negatives.
Right. Well, it is difficult then to reconcile the fact that we have 170 references in the medical literature, peer-reviewed. We have patients who are not only walking billboards, but running billboards. And yet, today in the United States, perhaps there are 1,200,000 patients on oxygen, a handful of thousand transtracheal patients. The question then is, are the pulmonologists, just because of the time or work or extra things that their staff have to do, hesitant, do you think?
Yeah, I think so. I can't quite put my finger on it otherwise. And maybe one of the issues is that if the pulmonologists were surgeons, it might be more popular. It may be that the division of specialties, the divisions of skill, so in order to get a transtracheal, you've got to get a surgeon.
Yeah.
At least that's my understanding, and particularly for the fast track.
Right.
You've got to get surgery involved, and maybe the surgeons aren't enthusiastic. That might be an issue too.
Okay. And I appreciate all this input because the caregiver, and I hate that word actually, it's life partner, married or not, right? I mean, you're giving care because you care.
Yeah.
Right. But could you look at the camera over here and just tell significant others of patients who are on oxygen why this isn't that scary, why it's not that big a commitment, you know, how working together, the two of you can get through this pretty easily?
Well, yeah, you caught me off guard, John. I haven't thought about this beforehand. To me, there was no burden. I can't recall any negatives. It seems to be like a very positive thing, and that has improved both of our qualities of life, and that's about the best I can say.
Okay, my friend. Thank you very much. I appreciate it. I know you didn't expect me to do this today, so.
Okay.
But I appreciate that very much.